Okay, perfect. Hi everyone, my name is Brindley Brooks. I'm the founder and executive director of HS Connect, or hsconnect.org. We are a patient advocacy group who was built by patients for patients, and our main focus is what others aren't necessarily super fond of, which is why I'm so fond of it, which is all of the education about HS. So we're not necessarily a group that provides emotional support in the traditional support group sense. We are focused on education and awareness and factual information about HS. So we do work very closely with all of the other patient organizations in the HS space, with Hope for HS, who's doing one about patient and caregiving in the other room, excuse me, with AHSID, with Hidradenitis and Me, who also provides the emotional and support groups that way, and everybody else in the HS space. So we are all very, very friendly. We actually are forming a patient advocacy group behind the scenes, or patient advocacy coalition, so that all of us can continue our work together. So just to preface that we're all in the same space, we all have our own niches, and it all comes together really, really nicely when we can all provide different pieces of organizations and information. So today we're going to talk about HS advocacy for influencers and people who want to become more of an advocate in their influencer journey. We're also going to cover some HS 101 because you can't do one without the other. So raise your hand. We're going to do a little experiences exercise first. Raise your hand if you've ever been told your HS was your fault due to weight or smoking. Raise your hand if you've ever felt shameful about your HS. Raise your hand if you've been given misinformation about HS. If you've alienated your friends, or alienated yourself from your friends or family. Been misdiagnosed. Scared to tell people about your HS? I know. Should we just hold them up? Put it down, I guess, if you have it. Stop seeking treatment because you were told that no one could help you.
Ooh, yep.
Had negative experiences with doctors. And been in a dark place that you don't want to go back to. So, although we have different journeys, we all have very, very similar experiences. Whether you're a stage 1, 2, 3, mild, moderate, severe, had surgery, have not had surgery, almost all of us have had these same exact experiences at some point or another in our journey. And our goal is to make it so that these experiences are no longer happening. And that's what happens through advocacy and awareness and factual information. So that's what we're going to kind of cover today. So you have the power to change the experience for others. Just like all of us have had those experiences, it's now our job that now that we have the stage, to change that for other people. For me, it's about changing it for my kids. I have 2 daughters who have HS as well. Sorry, it always chokes me up at this part. I have a 17-year-old who has stage 2, and I have a 21-year-old who's actually my stepdaughter and has stage 1. They're other than my husband, the 2 most important people to me in my life. And I started, part of my advocacy journey has been to change the future for them, because I didn't want them to carry the shame and stigma that I have for so many years about my HS, and I want them to have a different experience in life than I had. And luckily for them, they have me as their mom, so that's impossible not to have a different experience. My mom did the best that she could with what she knew, and unfortunately it wasn't a ton. But she has been an absolutely amazing parent, so I'm doing the same for my girls, but I at least am in a better position to have as much knowledge and experience as I have now. So it's almost like it's our responsibility to change the future for everybody who follows behind us. Have you ever wondered if you can be both an influencer and an advocate? Because you can. And we're going to talk today a little bit about what that looks like and how you do that. So for anyone who doesn't know, HS Connect just had a social media influencer workshop in Austin, Texas a couple weeks ago, where we brought 20 of the top social media people talking about their HS journeys online, and brought them all together to educate them about HS. Most people during that experience learned a ton about things that they thought they had correct information on. And it's because it's really difficult to find correct and accurate information right now on HS. So during that, we talked a lot about what does this look like in your advocacy journey? How do you take this information and then meld it into what you're doing on social media, which is sharing your personal stories? And it's so important. And the thing is, even if you've been sharing, as you'll find out, maybe you've been sharing inaccurate information, it doesn't mean you can't correct that. It doesn't mean you need to be embarrassed that you had inaccurate information before. Everyone is only doing the best they can with what they have. And unfortunately, what we have to work with is crap. So that's what we're here to work on changing, so that the more people we have giving the good information out, then hopefully we will silence all of the bad information. So let's talk about what HS is. And I think, anybody who was in the sessions yesterday, we talked a lot about this. It's a debilitating, chronic, complex inflammatory illness. So it's considered autoinflammatory, not autoimmune, and we'll get into some of the myths and misconceptions. And the reason it is being occurred is still studied. We don't truly know, like Jillian had mentioned in her cooking demonstration, chicken or egg. Is it the follicular process, or is it the inflammation that's coming first? Nobody really knows. We're still figuring that part out. It presents with extremely painful, reoccurring boil-like abscesses that may start out as pustules that can develop anywhere that hair follicles are found on the body. Okay, so we know about the most common places, but it's so important that we put this part first, that it can occur anywhere on the body there's a hair follicle. So that means anywhere other than the palms of your hands, soles of your feet, and the red part of your lips. Anywhere else on the body is game, including, eyelashes, head, neck, back behind your ears, anywhere else. But because we spend so much time focusing on where it most commonly occurs, what is happening is people are getting misdiagnosed. So a lot of men have HS on their back, a lot of women have HS on their back. But if they go into the dermatologist, because it's not in one of the most commonly affected areas, or where skin is touching skin, which I'm sure we've all heard too, they're misdiagnosed. So by perpetuating and talking about all of these things, this is how we start the change. And HS has a huge impact on our quality of life, physically, mentally, socially, emotionally, and financially. And I think we can all give a hear to that, because there isn't a point or part of our life that HS does not impact us. It does not discriminate against age, sex, race, sexual orientation, beliefs, intellectual or developmental or physical disabilities, blood type, size, shape, or geographic location. Anyone, anywhere, anytime. There's no cure for HS, and treatments aim to control disease severity and help reduce symptoms. So this, in a nutshell, is what HS is. And then we're going to talk a little bit about what HS isn't, and go through some of the misconceptions that I think we've all heard, faced, and dealt with on a daily basis. So what is an advocate? So a definition is getting support from another person to help you express your views and wishes, and to help you stand up for your rights, is the true definition of an advocate. And advocacy does not look the same for everyone. So in my advocacy journey, I have learned there are so many facets of this that I did not even know existed. HS Connect is just now starting to dabble into policy advocacy, like they were talking about yesterday. There are so many places that change needs to happen, it can become overwhelming. And for me, it's the education and the empowering of patients by giving them the correct and accurate information that is where my heart is. So it can look different. You can get involved in one area of advocacy and not others. It's a personal decision about what works best for you. I find it hard not to let my fingers keep going, because I want to be involved in everything, and I hate sitting on the sidelines, so it becomes really difficult for me to pare it down into just focusing on one thing. Maybe I'll get there one day, hopefully I'm not. So when we talk about advocates versus influencers, what's the difference? So influencers typically talk about your personal journey with HS, and advocates see the journey through the lens of many and aim to get factual information to all who need it. So this is where it kind of goes from when you work on being a combination of both, that you're sharing your personal journey, but also weaving in other people's experiences and the correct and factual information. And that doesn't mean you have to stop talking about your journey. It just means you kind of tweak it a little bit and do it a little bit differently. So again, it looks different for everyone. We need advocates in all different areas. We don't need everyone focused on the same thing, which is why it works so beautifully that all of our advocacy organizations are involved and everyone has a niche. You need emotional support, I can send you to these people. I vouch for them, I know them, I trust them, you will be good with them. If they need education, they send them my way. You know what I mean? So we all work really, really well together to make sure that the AHS community is served. And from what I'm learning, apparently that's definitely different than some of the other dermatologic conditions that are dealt with. So I feel really proud of that because there's enough HS patients to go around for everyone, and there are way more to come out and talk about their HS, so we just need to make sure we've got them all covered. So here's how HS looks in the HS advocacy looks in the community, and these are where you start. So taking any and all surveys and studies for HS that come up. Anything that is an option for you to participate in, take it. Talk to anybody, you know, share it on your page. Tell people about it, tell people to take it. This is how we start getting more accurate information about HS. And there are paid survey options. There are surveys that just come out that they're just looking for information. There's a plethora of things. So we're constantly contacted by companies looking for HS patients to take surveys and studies. So if you haven't subscribed to our site, do, because we typically will announce them on there, or follow us on social media, because we do post them on social media and encourage people to take all of those. Spreading facts and awareness, again, super important. There's something, you know, everybody's like, well, at least people are talking about it, even if it's wrong information. No, it actually hurts. It does not help. Because the number of people who end up misdiagnosed by sharing wrong information is not helping move HS forward. And then helping lead the community to good and factual information. HS Connect, honestly, we work with all of the doctors who have, well, I can't say all of them, but many of the doctors who have been here, Dave Louie, Steve Dave Louie, Stephanie Goldberg. We work with so many different HS specialists. A lot of times people will ask a question and I'll just text them to get an answer for them if I don't have the answer. So we're on a really intimate level with them in the information that's shared with us and that we're seeking from them, asking them so that we can learn and do a better job too. So just like we said, any awareness is good awareness? Nope, it isn't. And as much as you just want people to start talking about it, it's really counterproductive in a lot of ways. And we'll get into kind of why, and some of them are, you don't think necessarily about those reasons until someone tells you, like, okay, here's why. Because we all are like, well, at least I saw a commercial for it, at least it's happening. And yes, that's great because it's bringing awareness to the majority of the population. But some of that stuff can even be difficult for us to unwind because we're always going to be the smaller people in, the smaller fish in the pond. So more information on why inaccurate information hurts. By continually saying things we no longer know to be true, we keep people from getting diagnosed with HS. So by not sharing factual information, we're actually moving the disease backward. So what does that mean? And we're going to talk about some of that. So how do I know what's accurate and inaccurate? Well, you're going to hear some of that today. Finding trusted resources can be very, very difficult. Our definition of HS actually was run by 3 different HS specialists before we settled on it and before we posted that on our page, because we wanted to make sure that we're taking the medical definition of HS and the layperson's definition of HS and meshing them together so that it can be understood, so that people can see themselves in that definition of HS. Unfortunately, Google is not a trusted resource, neither is the American Academy of Dermatology, neither is the Mayo Clinic. All of these big hospitals, unfortunately, have inaccurate information about HS. And so this is where that change starts, and now you can probably understand why it gets a little bit overwhelming sometimes when you're like, where do we start? Because people are counting on those to be accurate and factual resources for them. And it's really difficult when you have a group like AHS Connect speaking out against that and saying, no, that's not true. But they are, these big conglomerates. They're also out of touch. So there's a lot of work to be done on just getting that kind of stuff corrected, and that's what we're hoping to kind of take over. We, as you guys have known, HS has been in the shadows for a really long time, and it feels like about a year ago in March, like the light turned on, and all of a sudden HS was in the spotlight. You couldn't escape it. People were talking about it, and it was almost like a coming out party. Like, we have finally arrived. Here we are, and it's our turn. And it's one of the things that I have trouble conveying is the amount of work that is being done on HS in the background. So there are so many people who are involved in making our lives better, you cannot even imagine. And the number of scientists that are working on medications, and the number of medications in the pipeline, and the number of things that are going to clinical trials is unbelievable. And we are at a really, really good point. So although it's never a good time to have HS, it's a really good time to have HS right now. We have a lot of attention, and in order for that to continue, that's what requires all of us to do the surveys, to participate in clinical trials if you have an opportunity to do that. Because without those things, we're stuck, and we won't get future help. And it's not like they'll keep coming back and asking us over and over to participate. If they don't get the number of participants they need, it's over. So it's all of our responsibilities to put ourselves out there to find things that will help everyone in the future. So now it's our turn, now that we're in the light, to change everything and to set the record straight. So again, HS Connect is the most trusted resource for education for patients. We have about 70 plus articles on the site. We have video interviews with specialists. We have the Hidradenitis Suppurativa podcast. We've got, there's just mental health resources like crazy. We even did art therapy and recorded those sessions specifically about HS that people can go on and watch and follow along with. And they're really easy. You need like crayons and paper, and that's it. You don't need anything special. You don't need an oil painting kit. And just go through and follow the prompts with Erica Pang is who we did it with. I could not believe like how much better I felt after doing it, and it was like scribbling on a paper, but damn, it was worth it. So we also have a medical advisory board, which some of these doctors are on. We've co-authored research, and we work with the best HS derms in the community. So they refer their patients to us. We're there like between appointments, go see these guys. We have a dermatologist list that is comprised of the HS Foundation's list, as well as patient recommendations. So if somebody in our community has had a great experience with a doctor, they tell us, we add them to our list, because we don't want to keep other HS patients from that person if they've had a good experience, because we know that that can be really hard to find. So why is all of this accurate information and info important? It stops the shame, because when we all understand our HS is not our fault, and we can just carry on with our lives without that shame, it's really, really important. It also helps accurate and timely diagnosis, which means appropriate treatments can begin. And stigmas hurt people and disease awareness. So I know how many of us have faced stigmas, in our HS journeys, and it is really difficult to overcome and to look past and feel comfortable moving forward. And so this is why it's so important. We should be able to talk about our HS the way that people talk about diabetes and high blood pressure and anything else. It's a medical condition. But because of the shame we've all been, I don't want to say forced, but because we all feel about our condition, we don't have the freedom to talk about it like it's a medical condition, like it truly is. So let's talk about some misconceptions. This is my favorite part. Misconceptions are that HS is rare. It's not rare. They think it's actually 1 in 100 people. So think about that in terms of anybody who's on a flight today. Think about most of those planes have 200 people on them. So you're not the only person with HS on that plane. Yeah. My kids are always like, I swear to God, if you stand up and say like, okay, who else has HS on here? We're out. And I was like, okay, maybe I can get my own flight that way. Or same thing in Costco. I'll walk in and tell my kid like, hey, we're not the only people in here with HS. And she'll be like, oh my God, Mom, please stop. But when you think of it in terms, think of it at a football game. think of it in any kind of arena. I mean, think about how many people, if it's 1 in 100 people, you guys, and how long have people hit it for and not told anybody about it because we could. So think about how many other people are doing that right now who haven't felt this sense of relief that you guys have felt by finding a community, by knowing you're not alone in this journey. There are still so many people back at the beginning. The only way to change this is to stop the stigma so that people come forward about their disease, so that they feel comfortable enough to put their hand up and say, as far as they can, yes, I think I have HS, and to get that help and to find a community. So 390 plus million people worldwide have HS. So it's also difficult when you think about the number of dermatologists in the world, or in the country even, that are knowledgeable about this condition. We got a lot of work to do to get everybody on board so that people are diagnosed appropriately, and that this 7 to 10 year diagnosis thing becomes a part of the past and something that is no longer part of our world. So we're actually getting this trademarked, but HS isn't rare, it's rarely talked about. So because we can hide it, we just don't talk about it. And as soon as, I don't know if you guys have had the same experience, but as soon as you open up about your HS and start talking about it, usually somebody comes forward and says like, oh, I think I have something like that. Or, you know, my older daughter's boyfriend has it. His dad had it. Her grandma has it. Her grandpa has it. It's her mom it's like, this is not rare. And even within families, we're not talking about this because of the shame that comes with that. Joey, this one's for you. Rare in men. So the answer is we don't truly know. The prevalence data about HS that we have is currently not accurate. That's being worked on. The GISA study just came out. I started reading it. It's like 50 pages about like who is truly impacted in the globe with HS. So there's a lot more information coming out about this. Until recently, all of the studies that have been done were archaic. Some of them were single center studies, which means it was only done, like, let's say in Detroit at a hospital here. You're gonna have a different population than you are anywhere else, you know, as you're moving through the country than you would in one single center. So for me, I question how those can be considered actually like scientific, because it's like if you're looking at something countrywide, that seems to have a lot more validity to it than something in a single center. Men, we know in general, are less likely to seek medical care. So for them to come out and speak out about their HS is definitely more difficult. There's what we always talk about, toxic masculinity, where men are supposed to just be super strong and not have any pain and carry on. That's a huge reason why they don't. It appears that HS impacts women 3 to 1. We don't truly know if that's accurate. And I think that as we start getting into this, we're going to find out that there are a lot more men affected than we think. In other countries like Southeast Asia, men are more commonly afflicted than women. Same thing in India. And again, we don't know if that's a society thing, a cultural thing. Why? We don't know. There's so much more. I would love to figure that part out. I'm dying to know. So it speaks to society, class systems, social burdens, cultural differences. These are things that can't be necessarily taken into account when you're just looking at the data at a surface level. So it's going to require a lot more understanding of the specific cultures and why. And then again, men are less likely to seek medical care in general. They're less likely to speak out on social media. They're less likely to be vocal about problems that they're having. And that's a societal thing, and that plays a major role in statistics. So we talked about this one a little bit earlier, location. So how many times have you heard it only impacts groin, armpits, underbreasts? That's like rhetoric. In my sleep I hear this. And again, the truth is that it can impact anywhere on your body there's a hair follicle. And that doesn't mean there has to be a hair coming out of that follicle. So it just has to be a follicle present. So anywhere other than the palms of your hands, soles of your feet, and the red part of your lips. And it's been called atypical HS if it shows up anywhere other than those locations, but it's not atypical. For people who face HS there, it's typical. So this is why it's so important that we change the way this is said and start out with it can affect anywhere there's a hair follicle. followed by the most commonly impacted places are these. Because you typically only hear the first thing that's said, so let's switch that around so people are hearing that. Misconception, HS is due to your weight. I mean, we said it in the first, raise your hand if you had been told that you needed to lose weight or quit smoking. I think it speaks for itself. Many thin people also have HS. It is not caused by your weight. Your weight can be a contribution to the reason why your HS may be worse. We know there's a link between metabolic syndrome and HS, but your HS is not the reason, your weight is not the reason you have HS. HS doesn't discriminate. It affects anybody. And we know that the microbiome of the skin, where you do have skin touching skin, can also create the perfect environment for HS to flourish. So that is why it can affect skin fold areas. But again, it's super important to note that's not the only place it can affect. But it's one of the places where dermatologists tend to focus on that attention. So anywhere that doesn't have skin touching skin, instead of just looking at the patient for where they are and how they're presenting, they have a mindset that says it can't be HS if it's on your thigh or on your leg or on your back, because that's not where HS impacts. So it's important for us to make sure that we're clarifying that. That it develops during puberty. It's true that a lot of people get it during puberty or their early teens, but it's also true that a lot of people get it at other points during their life. So both of those things can be true. We know that it can develop at any age, including from children to, like we had talked about, postmenopause. Some people start their HS postmenopause. We do know that there is research out there that says that, especially for men, that if you get HS in your 30s or 40s and that's when it starts, it comes on typically harder and faster than it does for any other group. So it's like even more important to notice that, acknowledge it, and then get treatment ASAP. This one is, it's not a sweat gland illness. It's not a sweat gland illness. This is old, outdated information. You'll hear many, many people saying that they had their sweat glands removed, and it's not a gland illness, and you can't even remove all the sweat glands if you tried. So I'm not sure how this got started or why they continue to tell people that, because I've heard it myself. We've even seen people go so far as to have mastectomies because their doctors have told them that if they remove their glands, so all of their breasts, that they won't have an HS recurrence. But because it isn't a gland disease, that's not helpful. So they've had mastectomies and their HS has returned. So it's really important to know and understand that. And if you have a surgeon who's talking about that, ask the questions. Don't shy away from asking the questions. I think we've been taught in society that we're not to question physicians, and that needs to change. Ask the questions. Do not be afraid to put your knowledge out there. In a lot of cases, we're educating physicians about our condition. So do not be afraid to do that. And even if you're looked at as the stubborn patient or the argumentative patient, it is your right to know what the answers to the questions that you're asking. And it's their obligation to respond to that. And if you don't have a good vibe about that, get out, because it's not going to get better. So it's their job to want to help us through this process. And so let's make sure that that's happening. So if you do get a bad vibe, find somebody else. It's just not worth it. So again, this is old information. They now know that it's not the case. It's not a sweat gland illness. All of this comes from really old, antiquated information. And we're not clean. Some of us are the most clean people you've ever come across because we're showering multiple times a day, acutely aware of our odor, and if we're aware of it, we know you're aware of it. If you need perfume, one of us probably has extra. And we're usually hyper aware of any odor that we have. Unfortunately, sometimes there's absolutely nothing we can do about it. And that's a really hard thing, and it creates a lot of self-consciousness issues for sure. So the other thing to remember on this is that overwashing and using too much antibacterial can actually do more harm than good. So you want to make sure that you're balanced in this approach so that you're not killing, because there's so much good bacteria on our skin too, that you don't want to annihilate all of that good bacteria. So it's kind of finding a balance. HS is contagious or infectious, another misconception. Nobody's getting it because they touched you. It's not infectious. Most of the time our abscesses are sterile, and if they're to culture them, they can get infected, but most of the time the infection is from a secondary infection. So after an abscess is drained, you now have a hole in your skin. And a lot of times what happens is that's where the infection comes in, is because you do have an open wound, and then getting that bad bacteria in there creates a secondary infection. But typically our abscesses are not infected. So when they give us antibiotics, they're giving us the antibiotics for the purpose of the anti-inflammatory properties that they provide, not because we have an infection. So somewhere along the line, all of this got crisscrossed. We do get antibiotics for infections if you have a secondary infection. But when you're given antibiotics at the beginning of your treatment plan, it's usually on the step therapy. That's the very first treatment plan. I'm sure many of us have spent months and months, if not years, on antibiotics trying to prove that they don't work. That they're given to us for their anti-inflammatory properties, not necessarily because we have an infection. So again, if you do have an infection, they are used for that as well, but different antibiotics than we typically take. And then the smell comes as a result of pus, which is a combination of dead white blood cells and bacteria, tissue debris, serum, and living or dead microorganisms. It's nothing to do with you. It has nothing to do with anything on your body in particular. That's just what pus is. So HS is not autoimmune, it's autoinflammatory. It does not meet the markers for an autoimmune condition. This is very commonly misunderstood. The way that I like to break it down is that autoimmune, the body attacks itself, and autoinflammatory, which is where we are, our bodies are overreacting. So this is why we end up with flares. Our bodies are overreacting to any kind of stimulus that's creating that flare, or creating the inflammation or the follicular occlusion. It basically is like sending all of its resources over to that area to try to fight that off, but we're not attacking ourselves. We're just overreacting to this stimulus. So there's no long-standing research supporting or classifying HS as an autoimmune illness. The past several years have linked it to autoinflammatory. That could change. I mean, it's totally up for debate. I think it's not necessarily debate, but it's gonna take a lot more research to come out to say that it is autoinflammatory before it can be moved to that category. So for right now, it sits in the autoinflammatory category. And then talking about HS, words matter, and here's why. Because if we're not accurately talking about our condition, we lessen our chances to get accurate diagnosis. So boils are their own medical definition. We know with social listening that most people refer to our abscesses as boils because it is the most commonly understood definition of something that resembles what we have. So the reason though that if you say boils mean that they come up and they go away and they're not recurrent. What we have are abscesses or nodules. I mean, there's many, many different names for them. But what we've liked to try to do is to move to boil-like abscesses. So you're capturing what people can know and understand as boils, but also moving it towards the right direction of calling them abscesses, which is the more accurate term for our condition. So when we talk about boils, going with boil-like abscesses, making that simple switch, because when you go in and you talk about a boil to a physician, they're instantly going, this is a singular occasion that you're having this is not recurring, and sometimes they won't even ask you about the recurrence. But if you're talking about a boil-like abscess and this thing keeps coming back, instantly that's going to help them change direction and look at what your diagnosis may be in a different way. Skin on skin or skin folds, again, you know, it's difficult to kind of change the way that people think about this. But just again, referring to the HS can appear anywhere on the body that there's a hair follicle, and it's okay to correct people on these things. This is what's necessary. is to start moving towards, and gently correct, not, we don't need to fight. And some people will want to fight you even if you're nice about it. When we talk again about armpits, groin, inner thighs, under breast, changing that to use anywhere on the body there's a hair follicle. So it starts with just changing our vernacular in the way that we talk about our own condition, to making sure that it's relatable for other people and then also accurate. Avoid giving specific time periods, and this is where when you're telling your story, that's your story about when it started for you. But making huge generalizations is really difficult for people who fall outside of that category. So talking about any age, so we've kind of gone now with the motto at HS Connect about it can impact anyone, anytime, anywhere. That is damn vague, but it is true. Because the more we silo these things into categories, the more people don't see themselves having HS. So if we're constantly talking about, again, like it's a women's disease compared to a man's, you know, that men are not as impacted, what makes Joey want to go to the doctor? He's gonna be like, I have a woman's disease, and I was personally affected by that at 16 when I was formally diagnosed. I was told I had a black woman's disease. And it caused me not to seek care for 10 years because as a 16-year-old Caucasian female, what do I do with that information? I thought if I went to a dermatologist, they're gonna think something's wrong with me because I didn't fit my disease demographic. So it's those kinds of things that you think is just a statement, but they have huge impacts on people's lives. And I'm sure everyone has experienced something like that in their own HS journey that makes you either stop in your tracks, not seek care, derail completely. It can be very dangerous, and it can really help or hurt people from getting the help that they need. So same thing with women more than men. It can impact anyone of any gender. And then African American women most commonly afflicted. Again, we're not sure if this is actually true or not, and we're waiting for more data to come out. We do know, I have it written on my sticky note on my computer screen, but that people who face social health disparities, it is more difficult and burdensome for them to have HS. And I think that that's, we all know that. It's difficult to find a derm anywhere. And then it can be a heavier burden for people who face social health disparities. So how we describe our disease is very important. It may seem like it doesn't matter, but it really truly does matter. So moving from influencer to influencer advocate or advocate influencer, we were trying to find a cute name for this, didn't really happen. We're like, how do you move that into one? So starting your journey may seem overwhelming, but it's not. Find trusted resources that you can pull information out of. Pull an article up and talk about the article. Share any and all resources, survey studies, clinical trials, anything. And correct information when you see it in the community. It's okay to talk about it and to speak up about if something that you see is inaccurate. AHSID, which we saw her earlier, is a great example of a switch from an influencer to an advocate influencer. When I met her at the first Beautify AHS project, we instantly clicked, and she said, I want to learn more and to do more in this space and figure out how to become an advocate as well. And she's a great person that has done a good job of this, of kind of mixing it in and figuring out how it works best for her and what that looks like. So she has embraced the role and is always looking to learn more and educate the HS community with factual information. She's no longer afraid to correct information, and she was for a really long time, and I completely respect that because people are not nice sometimes. And she's excited about helping be the change that's needed in the HS community and understand how important her role is to help people get diagnosed and have better treatment outcomes. So it's really, it's simple. It sounds complicated, but in talking to some of these guys from the social media workshop, they were like, help us figure out what we should talk about per week or per month, because it becomes overwhelming for them too. So I'm trying to figure out how does that work? What does that look like? And how do we get people giving the same message out so that we're kind of canvassing the entire community with the correct information, and hopefully the other information will just go away or stay in certain support groups that we can avoid. Okay, where are we not moving forward?
Sorry, don't get sick and I'm going through this quick.
Oh, I guess it took my last slide away. So it was a thank you slide for listening to my diatribe, and then asking if there's any questions. I'm happy to take them. I am not qualified to answer all questions, and I will not lie to you, but I will tell you if I'm not qualified to answer a question and try to get an answer for you.
I have a question.
Yeah.
Doesn't, doesn't, hidradenitis definition is inflammation of the sweat glands filled with pus?
Yes, and it's an old name, and I looked at taking on that journey as well, but after I learned about changing fatty liver?
Alcoholic fatty liver.
Yes.
Oh, okay.
Once I read about that and I was like, I'm out. It was like a 10-year process to change a name of something like that
Yeah, medical terminology, that's what it is.
Yep.
But when you say it's not sweat glands,
Yep.
it's like, that's.
Yeah, because I don't know who has the 10 years to take that journey on, but they're welcome to. I'm happy to help, but I was like, I cannot fight this fight for 10 years to change a name. And then somebody said, well, what would you call it? I was like, that's a really good question too.
Yeah, because I was misled by the name.
Yeah.
And then if someone asked me, the medical term.
Yeah, and it's been through a couple different names.
Oh, okay, I didn't know that. I
Yeah.
didn't learn this until she, taught me.
Yeah. So no,
Even though I had it all my life, I didn't know.
Yes, I looked at taking that part on and was like, I'm gonna pass. Yeah,
Okay.
That's where my advocacy ends apparently. Yeah, I said I was
Say
due.
no sweat gland, and I'm going,
Yep.
that's the medical term.
I know, and that part is really difficult, but at the
Right.
same time, they don't make anything easy when it comes to that.
Right,
Yeah,
okay.
but good question for sure. Anyone have any other questions?
I have a question. I don't know if you can answer it, but might as well try.
Sure.
So I've actually tried to do clinical trials and been denied because
Okay.
I wasn't qualified according to them. So do you know if there's anything that can be done to get into these clinical trials, or is it just a matter of keep trying until something pops up kind of thing?
So this is something we've talked to pharma about. We're at the point now where we're starting to work with pharma companies at the point where they're designing trials to help figure out what can be done and who their target audience is, who they need, and work on that part of it. We also understand that there's fatigue that comes with that because you're like, okay, well, I've been turned down 3 times, so why should I bother trying again? And that's something that we are also talking to them about because you can lose hope for participating in something like that that's very important. So that's one of the reasons, like for us, if we're asked to recruit or help find people for clinical trials, on our page, we go through what that inclusion and exclusion criteria is, like who can participate, who can't participate. We break that down into layman's terms so that you can look at that and say, I fit this criteria or I don't, and not go further than that if you don't fit that criteria. Also, what is required of me? If this is something I have to travel for, 3 times a week for 4 weeks, I can't do that because my schedule won't allow it. So we're trying to help silo some of that so that you're not spending a bunch of time applying for things that you're not gonna qualify for. And unfortunately, clinicaltrials.gov is not a great help. Everything is very difficult to read, even for me on there, and I feel like I know kind of what I'm doing. So we're trying to really take some of that back and put it in the hands of the patients who are looking to participate and making it easy. So we have a clinical trial page on our site that has things that are going on from clinicaltrials.gov, and then the specific, any companies that come to work with us, we do this process with them where we're like, our patients need to know if they qualify for this, if they don't qualify. Let's not put people through the ringer just to find out every time that they don't qualify. And we do know that there's more clinical trials coming geared towards more stage 1 and stage 2, because as you know, right now everything is stage 2 and 3, so there's definitely more coming in that area, which is really exciting too.
Thank you.
Yeah.
I appreciate that.
Can I ask you, what was your motivation, why you wanted to be a part of a clinical trial?
Desperation.
So you were looking for like a new drug treatment?
Yeah, just looking to I'm literally the type that will just try anything. So if it's available to me, why not just try?
Okay.
Like I've always just kind of been that type of individual, like personality wise, I guess. So yeah, like nothing, there's definitely medications I haven't tried that are available, but again, if I have the ability, why not just try it to at least help other people as well? Because I know that me doing that can help other people as well, because we're all struggling. So it's not just about me, I guess, in essence. It's about everybody, because this is a struggle, you know what I mean?
And can I just give a hand for that? Because like we freaking need that. Like we need people like you who are willing to do it, and it's hard. Why were you disqualified from them, or?
I don't know. It like
Okay.
had me do like a test
Yeah.
or like answer questions, and then right at the end it was like, you're not qualified.
Was it rare patient voice?
I don't know. I
No,
can't
'cause I
remember.
get
This was
that
a while
a lot
ago.
with
This
them,
was
like,
a while
oh,
ago,
wow.
and like it was just a weird process in like trying to apply, I
Uh-huh.
guess. Because like had it been laid out for me, like, hey, these are what you need, I wouldn't have done it. You know what I'm saying? But I had to go through the process of answering questions or whatever, and then it tells me at the end like, now you're not qualified. So
Okay,
you're like,
so some
okay,
of
so I don't even know
those-
why.
Yeah. Okay. So some of what you're saying may be more like like she had said, rare patient voices.
Understood?
Instead of like an actual clinical trial, because a clinical trial is for like medication.
Yeah.
And those, that's one of the things that we're also trying to help pharma understand is like it would be really helpful for us to know and understand as a patient why I didn't qualify for it.
Right.
I think it also will help in the future for you to know, oh, I just didn't qualify for this one because of this specific reason, and looking through what their inclusion exclusion
Yeah.
criteria is to say, okay, I'm gonna experience the same thing with this one. But I know like for personally on Rare Patient Voices, they do send emails like, hey, do you wanna participate in this study or this survey? And you'll go, I get the same thing. It's like asking for people just like me, I go to take it and I don't qualify, and I was like, well, okay.
Right.
Like, don't you know enough about me already from all my answers to these questions?
Yeah,
You
yeah.
know? So yes, that can be sometimes frustrating. And then we do also, like we do try to do surveys that anybody sends us. We work with a lot of universities who are looking to gather data on HS, and send those out that are open to like anyone in the US or things like that, so that people do have an opportunity to participate whatever they can.
I'll just mention, like, just tell your physician that you're working with that you do want to be in a clinical trial, because there's different kinds of clinical trials. So there's ones that are trying to get a drug approved, which is a little bit more stringent, and then they have other trials that are looking at the drug use like long term. So those criterias are not so restrictive. And then if you are on a drug and you want to be a part of a data set, you can ask your doctor if there's a registry. So like for instance, for one of our drugs that's already approved, on the psoriasis side and rheumatoid arthritis, we like to collect data about pregnant women. So like we want pregnant women to be a part of our registry, so then we can show clinical data that shows that their experience on the